ये वाला बैनर करके छोड़ देता हूँ, चेंज हो जाएगा बैनर। तो अभी देखते हैं, ठीक है, कर लो इतने काम, अभी तो हो ही जाएगा, पता चलेगा। हो गया लाइव। लूनी मैम हो गया लाइव, है ना लूनी मैम?
Sir, can we talk on phone?
हो गया लाइव।
फोन पे बात करते हैं सर। Bhavya, good morning. भव्या,
गुड मॉर्निंग मैम. गुड
भव्या,
मॉर्निंग मैम.
आप कौन सी क्लास से हो बेटा भव्या?
मैम 8th D.
अच्छा, और हिमांशु? भव्या, गुड मॉर्निंग. हिमांशु, आप कौन सी?
मैम 8th D. गुड मॉर्निंग मैम.
आप कौन सी क्लास से हो बेटा भव्या? हिमांशु, आप कौन सी क्लास से कह रहे हो
मैम
बेटा?
8th D.
हिमांशु भी 8th D से. और हिमांशु? भव्या, गुड मॉर्निंग. हिमांशु, आप कौन सी?
गुड मॉर्निंग मैम. गुड मॉर्निंग मैम.
नहीं, हिमांशु कौन सी क्लास से बेटा?
8th D. मैम हिमांशु एंड भव्य मित्तल both are from 8th D.
ओके बेटा.
गुड मॉर्निंग मैम.
COVID-19 pandemic led to a dramatic loss of human life. The COVID-19 pandemic has led to a
Muskan beta, you are speaker announcer today.
Yes, ma'am.
Okay. Himanshu, you are not a announcer today, no? Himanshu,
Yes ma'am.
you are not a announcer today.
Ma'am, I don't know.
Beta, leave the meeting. You have to join from the YouTube.
Okay ma'am.
Muskan, with whom you have to do that?
Ma'am, it's just me.
Okay.
Ma'am,
Yes, Muskan.
ma'am, I had to ask this that as soon as we have Dr. Shrishti Agarwal with us and it's 9 a.m., shall I begin straight away?
Let the Neha ma'am come. I will, please, it's better to come talk to her.
Okay.
The students are requested to leave the Zoom meeting. It's only for the teachers. You have to join YouTube channel. Muskan, just you have to repeat again and again this statement.
Ma'am, what statement?
First, you have to say that students don't have to join this Zoom meeting. You have to join YouTube channel.
Yes, ma'am.
Okay.
And ma'am, but the students don't have this Zoom link.
Many of the students have still.
Okay.
Okay. Thank you.
Thank you.
मंगाने 6 कम मंगाने 44 और कुछ वो अपना रूम फ्रेशनर लाने थे। हाँ वो 50
All teachers are requested to switch off your mic.
किसी भी कंपनी का मंगा लो मगर कांच
All
की
teachers are requested to switch off your mic.
चेक कर लेना।
सब अंदर चल गए। उसके बाद सुला ही रहते हम उसको सोने में। हाँ
Ma'am, do we begin?
आपने शामिल कर लिया, बहुत सारे दलों ने समझौते कर लिए। अगर मोटिवेशन मोबिलाइजेशन जबरदस्त नहीं होता नहीं आप बन नहीं डॉक्टर खान
Just one more minute, dear. Okay.
Yeah, good morning, everyone. Am I audible?
Yes, ma'am.
yes
Principal ma'am, yeah, good morning, everyone. Principal ma'am is joining us just in a minute, and we are about to start the session very soon. I request Muskan and Dr. Srishti to turn on their cameras, please.
Good morning, ma'am.
Good morning ma'am
Good morning, ma'am.
good morning ma'am
Good morning.
good morning
Good morning, Srishti.
Morning, ma'am.
Welcome.
good morning everyone
I think
Good morning, ma'am.
Good morning, Dr. Srishti.
Good morning.
Good morning.
Good morning, everyone.
Good morning, Dr. Srishti.
Good morning.
good morning Dr. Srishti
Good morning, ma'am. Good morning, everyone.
Neha ma'am, I think we can start the session,
Yeah.
ma'am.
Yeah, yes,
Ma'am.
ma'am. Good morning, Dr. Srishti. I request Muskan to please begin the session. Ruchika, ma'am.
The COVID-19 pandemic has led.
Yeah.
Okay, sure. The COVID-19 pandemic has led to a dramatic loss of human life worldwide and presents an unprecedented challenge to public health and the world of work. Good morning, everyone. We welcome you all to this interactive session on leading through COVID-19. We're very pleased to have our alumni, Dr. Srishti Agarwal, among us as the speaker. Dr. Srishti Agarwal holds her MBBS degree from MAMC and has done MS from Fellow of Indian College of Obstetricians and Gynecologists. Her area of expertise pertains to obstetrics and gynecology. She is a consultant obstetrician and gynecologist at Agrawal Nursing Home, Trinagar, Fortis Hospital, Shalimar Bagh, Apollo Cradle, Moti Nagar, Cloud9 Hospital, Punjabi Bagh. I'd like to let's welcome Dr. Srishti Agarwal, and I'd like to request her to deliver her talk.
Good morning, everyone. I am Dr. Srishti, and I'm really thankful to Ms. Alka Sahani ma'am, the principal ma'am, Alka Agrawal ma'am, and Neha Gawur ma'am, to giving me this opportunity to be present here in front of you all, in front of my school, to be here on this platform, delivering, giving some important tips regarding COVID. And it's been like almost 23 years I passed out from the school, and the memories are still fresh in my mind about the school. My teachers, SP Dhingra ma'am, Poonam Gupta ma'am, Agrawal ma'am, Gupta sir, and all, they who have nurtured me and brought me to this platform that I can be sitting here in front of you all and talking about like this here. So it gives me a lot of pleasure to be here in front of you all. And today I would like to talk to you all about the COVID-19, what impact it has put on our lives, what we all are going through, how we can prevent it, what are the modes of prevention. So I would be really brief about all this and would not be going too much into the treatment. As you know, we have already come a lot into understanding COVID-19. So I would quickly take you through the journey through the COVID-19, what all measures we have taken and what all we are going to do further, and how can we prevent all this. Okay, so I would like to share my screen. Can you enable me to share my screen?
Already enabled. Can you check it again?
Yeah. Just a moment. Can you all see my screen? Is my screen visible?
Yes.
Yes, okay. Visible. So I shall begin now. So I'll be taking you through this small presentation regarding COVID awareness. So what is COVID-19? So you all know in 2000, this COVID has been leading to our lives, has been in our lives since 2019. And it was first detected in China, in the Wuhan city of China, where a subset of people who were detected to have respiratory symptoms. And from those people, this COVID-19 virus was isolated. So it's a virus, and you know that in the history of microbes, these are the worst scourges of mankind. They are a threat to human survival, and they have killed more men than all the wars. It's kind of a biological war which is happening worldwide. This COVID-19 disease had led to a pandemic worldwide. So now what is a pandemic? As we all know, that some diseases are confined to some geographical locations, so we call them endemic. The pandemic is an outbreak of a disease which is occurring over a wide geographic area and is exceptionally affecting a high proportion of the population. Our world has experienced a lot of pandemics till now. The first one was Spanish flu, which occurred in 1918 and occurred till 1920. Then Asian flu came. Then AIDS pandemic, which is still present, till date today. Then we experienced swine flu pandemic in 2009. Then Ebola virus pandemic, and now our world is going through the coronavirus pandemic, which started in 2019 and it is still ongoing. Now, what are the main symptoms, signs and symptoms of coronavirus, which we should be concerned of? The patients usually, the patients will come to you with complaints of कि डॉक्टर साहब मुझे बुखार हो रहा है. 90% of the patients will say कि मुझे बुखार है, मुझे 2 दिन से सूखी खांसी है, मेरा बदन टूट रहा है, I'm experiencing a lot of fatigue, मुझे बलगम आ रहा है, sputum production हो रहा है, shortness of breath, सांस लेने में दिक्कत हो रही है, जोड़ों में दर्द है, पूरा बदन टूट रहा है, सर्दी खांसी से बुखार आ रहा है, उल्टी है, उल्टी जैसी फीलिंग है, which is experienced in around 5% of patients, nasal congestion, which is almost present in 5% of patients. Some patients, now we are seeing that some patients will come with complaints of diarrhea, कि लूज मोशंस हो रहे हैं, पेट में दर्द है, बलगम है, खांसी में ब्लड भी आ रहा है, खून भी आ रहा है. So the main symptoms which the patient will come with is fever. 90% of the population will come कि मुझे बुखार है, 2-3 दिन से मुझे तेज बुखार है या हल्का बुखार है. Now, how does it spread? How do we know, what can the measures be taken? First, we should know that how does the coronavirus spread? And then we can talk about how we can prevent the transmission. So the main method of transmission of coronavirus is through droplet transmission, airborne. Airborne means that it is spread through air. When a person sneezes or coughs, an infected person, when the person will sneeze or cough, the infected particles will go in the air. Now this air, through the air, this infected particles can go onto your hand. And when you touch any surface or any person with your infected hand, this coronavirus particles will be transmitted from the infected person's hand to the normal person's hand. And when this person will touch his or her hand onto his mouth or face or nose, this virus gets transmitted to that person through the respiratory tract. One method is this. Other is like a person is coughing or sneezing, and those airborne particles that get deposited on the fomites. Fomites means any surface, table, desk, or any surface with the person comes in contact. Either he touches that surface with his infected hands, or the cough particles, they get deposited on the fomites. Now these infected particles, they get deposited on the fomite surface, and when the person touches that surface with his bare hands, again the particles are transmitted to his bare hands, and now the person touches his nose, mouth, eyes or ears, and particles get transmitted and the person gets infected. So the main mode of transmission of coronavirus is through airborne, through the respiratory secretions. So all methods like to prevent coronavirus transmission will focus on how to prevent the respiratory airborne transmission of this virus. Now, how we can prevent the transmission of coronavirus. So the 3 main strategies of prevention of coronavirus will hand sanitization, social distancing, and wearing masks. I'll be talking about this briefly in detail about all of these 3 methods. First, we talk about hand sanitization. This is the first and foremost prevention strategy for preventing coronavirus or rather any airborne disease. For washing your hands, there's a particular method with which you can be washing your hands. You should wash your hands with soap and running water when hands are visibly dirty. अगर आपके हाथ बिल्कुल गंदे दिख रहे हैं तो आपको उसे सोप और पानी से धोना है. एटलीस्ट 20 सेकेंड्स तक उसे आपको धोना है. कम से कम 20 सेकेंड तक उसको धोना है आपको. और अगर आपके हाथ डर्टी नहीं है, then even you can clean it with a sanitizer or a hand rub. You have to wash your hands always after coughing or sneezing. If you are taking care of the sick patients, if you are preparing any food before, during, and after you prepare food, before eating, after the use of toilet, when hands are visibly dirty, or after handling animals or animal waste. In all these conditions, you definitely need to wash your hands. I will be showing a small video on the correct technique of washing hands. You can just watch it. So as you saw that the correct technique of washing hands, there are 7 steps of washing hands, and you should be at least spending 20 seconds keeping a handful of soap on your hands and then doing it properly. So this is the ideal way with which you should be washing your hands. Now, the other way of cleaning your hands is with sanitizer. Somewhere like you do not have, as you saw, that the correct technique of washing hands. With sanitizers, a lot of products with alcohol-based sanitizers are available in the market, but the ideal sanitizer should be containing at least 70% of alcohol in it, with which the virus can be destroyed. So to correctly apply sanitizer, you should be apply at least a palmful of alcohol-based sanitizer to cover all the surfaces of your hands. Then rub your hands together using the right technique until they are dry. And this entire procedure should also take at least 20 to 30 seconds. Now, some people believe that wearing gloves is another way of preventing the transmission of coronavirus rather than cleaning your hands or using hand sanitizer. But this is not correct, because wearing gloves will risk transferring germs from one surface to another and contaminating your hands when you're removing them. Like you are wearing gloves, you touch a surface जहां पर already coronavirus के particles deposited हैं. So you deposit those COVID particles on your gloved hands, and then you touch another surface जहां पर virus नहीं था, then again वहां पर आप COVID को transfer कर रहे हैं. So gloves पहनना is not the replacement of washing hands. So you should be washing hands with soap and water or sanitizer rather than wearing gloves. ग्लव्स का यूज सिर्फ मेडिकल पर्सनल या जहां पर हमें जरूरत है वहीं पर ही रिस्ट्रिक्टेड रहना चाहिए. The third way of preventing coronavirus, the third measure to prevent the transmission of coronavirus is social distancing. Social distancing is very, very important. You should keep at least a distance of 1 meter from others. In a gathering, when there is a lot of people, at least 1 meter distance should be kept between two people. Because what happens, the coronavirus, as we have seen, it is transmitted through air, through the respiratory droplets. So the particles will not travel to more than 1 meter distance to be transmitted from an infected person to the other person. So keep at least a distance of 1 meter from others. You should avoid crowded places. Open air spaces are safer than the closed spaces, and shorten time period with others within 15 minutes. Should not be staying with others more than 15 minutes. Now, wearing mask. The other way of preventing coronavirus is wearing mask. We should know about what is the proper way of wearing mask, what are the different types of wearing mask. So the proper way of wearing mask is that we should wear mask with covering of mouth and nose. It's not that you cover only your mouth or only your nose and you think that you are preventing transmission of COVID virus. So you have to wear it with covering of mouth and nose. While removing, utmost precaution needs to be taken that you should not be touching the front side of the mask. The outer side of the mask, you don't have to touch with your bare hands because that contains the deposition of the COVID-19 particles. After you remove the mask from your face, you have to discard or sanitize your hand, discard the mask and sanitize your hands after use. Now, different types of masks are available like cloth mask, surgical mask, and N95 mask. How can you protect others from getting sick? Different measures which you should be taking are like when you are coughing or sneezing, you should cover your mouth with nose or with flexed elbow and tissue. You have to throw this tissue into the closed bin immediately after use. And after you do this, you have to clean your hand again with sanitizer or clean your hands with soap. You have to avoid close contact when you're experiencing cough and fever. If you're having any symptoms related to COVID virus, like if you have fever or if you have cough, avoid contact with others, isolate yourself, avoid spitting in public, and seek medical care. Inform your doctor or inform your medical personnel and ask about like what symptoms you are having, what problems you are facing with, and seek medical help as early as possible. Now, general measures which you should be taking at home are like regarding food. You should have to practice food safety, like use different chopping boards and knives for raw meat and cooked food. And you have to wash your hands between handling raw food and cooked food. Even in areas experiencing outbreaks, the meat products can be safely consumed. Like there is a myth that this area has an outbreak of COVID, so we should not be using meat. So that is not right. They can be safely consumed if they are thoroughly cooked and properly handled during food preparation. So this is the most important thing. What traveling precautions you should be taking? If you are supposed to travel somewhere, so what precautions you should be taking? Like if you have fever and cough, stay at home, do not travel. And if you have fever, cough, or difficulty in breathing while traveling, you seek medical care with your healthcare provider. You have to avoid contact with people suffering from fever and cough. Clean your hands with sanitizer or soap and water, and avoid touching eyes, mouth and nose. Again, while coughing and sneezing, use a flexed elbow or cover your mouth and nose and throw the tissue immediately in the bin and wash your hands. And if you choose to wear a face mask, be sure you cover your mouth and nose and avoid touching the mask once it's on. Immediately discard the mask after use. Now, there are some situations which arise in home, in medical facilities, if anybody is suffering for COVID-19 or is showing symptoms of COVID-19. So what are precautions you have to take in these common situations? I'll talk briefly about all these. So now there is a situation like in which commonly arise in houses that कि मेरे घर में एक पेशेंट है जिसको कोविड है या कोविड जैसे सिम्टम्स हैं या आसपास के लोगों में कोविड है, तो मुझे अपने घर के क्लोथ्स, टॉवल्स, बेडशीट्स, इनका मुझे क्या करना है, इनको कैसे वॉश करना है. So if suppose there is nobody in your household who is suspected of COVID-19, you can just wash the patient's clothes, towels and bed linen separately and just dry it in sun for at least 30 minutes, or you can dry it in sun, or you can soak the linen in 0.05% chlorine for at least 30 minutes. this is what is to be done. And you should be wearing heavy duty gloves before you handle the patient's linen or bed sheets or towels. And after you have washed his or her clothes, you have to again wash your hands at the end of the process. That can be done. Now, should you be shaking hands with the person who is having COVID-19? As I showed you in my first slide, that coronavirus can be easily transmitted if an infected person shakes hand with the non-infected person. So this is absolutely to be prohibited, because respiratory viruses can be passed by shaking hands and touching your eyes, nose, and mouth. So you greet the people with a wave, a nod, or a bow instead, and should not be shaking hands with the infected person. Now, what are the conditions in which you should be scared, or which should bother you, that you should talk to your doctor or seek a medical help? So what are those conditions? Most importantly, if you are age of 60 years or older, or if you are experiencing any chronic health condition. Chronic health conditions means if you're a diabetic, hypertensive, or a heart patient, or a cancer patient, और एनी सॉर्ट ऑफ क्रॉनिक मेडिकेशन, किसी लंबी बीमारी का इलाज आपको रेगुलर बेसिस पे कोई दवाइयां खा रहे हैं, या आपकी उम्र 60 साल से ज्यादा है, तो ऐसी कंडीशंस में अगर जरा सा भी आपको कोई दिक्कत है, अगर आपको फीवर है, कॉफ है जो कि 1-2 दिन से ज्यादा चल रही है और वो बढ़ती जा रही है, या फिर आपको बोलने में तकलीफ हो रही है, गले में दर्द है, ऐसी कोई भी दिक्कत होगी तो आपको तुरंत अपने डॉक्टर को इन्फॉर्म करना है। इन चीजों को लाइटली नहीं लेना है आपको। अगर आपको सांस लेने में तकलीफ है, अगर आपको छाती में दर्द है, पेन इन द चेस्ट है, इफ यू हैव सीजर्स, अगर आपको दोहरे की शिकायत हो गई है, अगर आपको कंफ्यूजन, डिजीनेस, आपको ऐसा लग रहा है कि चक्कर आ रहे हैं, या कुछ दिक्कत हो रही है, तो आपको तुरंत अपने डॉक्टर को इन्फॉर्म करना है। और भी कंडीशंस हैं, जैसे कि यूरिन करने में प्रॉब्लम हो रही है, यूरिन कम आ रहा है, यूरिन नहीं आ रहा है, अगर आपको खड़े होने में दिक्कत हो रही है, घबराहट महसूस हो रही है, आपको वीकनेस महसूस हो रही है, चलने में दिक्कत है, आपको सीवियर मसल पेन है, पूरे शरीर में दर्द है, जोड़ों में दर्द है, आपकी जो पुरानी कंडीशन जैसे डायबिटीज है, हाइपरटेंशन है, कोई भी ऐसी बीमारी जिसकी आप पुरानी पहले से दवाइयां देते हैं, उनमें किसी भी प्रकार की आपको लग रहा है तेजी आ गई है, वो बिगड़ रही है बीमारियां, तो ऐसी कोई भी कंडीशन है तो आपको तुरंत अपने डॉक्टर को इन्फॉर्म करना है। इन चीजों को आपको लाइटली लेकर घर पर वेट नहीं करना है कि ये अपने आप ठीक हो जाएंगी। Children under the age of 5 years, they are also very much susceptible to COVID. In the earlier wave of COVID, जो first wave of COVID हमारी आई थी, उसमें हमने देखा था कि बच्चे इन्फेक्ट नहीं हो रहे हैं, बट सेकेंड और थर्ड वेव में हमने ये देखा है कि बच्चे और यंग एडल्ट्स भी काफी इन्फेक्ट हो रहे हैं। फर्स्ट वेव में हमने देखा कि जो 60 साल से ऊपर के लोग थे और जो क्रॉनिकली इल पेशेंट्स थे, तो वही इन्फेक्ट ज्यादा हुए थे। यंग पीपल एंड बच्चे, दे वर not infected. But now with what we are seeing symptoms in young patients and young children also. So if any child who has high fever, तेज बुखार है, बच्चा बोलता है कि मुझे दर्द हो रहा है चेस्ट में, सांस लेने में रैपिड ब्रीदिंग, तेज सांस ले रहा है, सिवियर मसल पेन है, जोड़ों में दर्द है, पूरे बॉडी में दर्द है, ऐसी कोई भी कंडीशन है, बच्चे के डॉक्टर को आप तुरंत इन्फॉर्म करिए। अदर कंडीशंस जैसे कि ब्लू लिप्स, बच्चे की लिप्स अगर आपको लग रहा है कि नीले हो गए हैं, बच्चा वॉमिट ज्यादा कर रहा है, दूध नहीं पी रहा है, पानी नहीं पी रहा है, ब्रेस्ट फीडिंग नहीं ले रहा है, ऐसी कोई भी कंडीशन जिनमें आपको लगे कि बच्चा सुस्त हो गया है, तो आपको तुरंत डॉक्टर को इन्फॉर्म करना है।
मेरे पेपर
स्लाइड्स मूव नहीं कर रही हैं। Now, pregnant women. Pregnant women are also immunocompromised, and they are also at high risk of catching infection. So any change in the normal behavior, normal pattern of breathing, fever, cough, or any sort of difficulty in breathing, in speech, seizures, confusion, same symptoms which a normal person may be experiencing. If a pregnant lady experiences all these symptoms, then she has to contact her doctor immediately, because these can be signs of COVID. Now, what care you should be taking at home for the patients who are sick and for the caregivers? We'll talk briefly about all this also. For ill people, for patients who are sick, what you should be doing at home? If a patient is sick and a patient is isolated at home and the patient has fever and cough, she has to clean her hands frequently, again, so with soap and water or alcohol-based sanitizer for at least 20 seconds. Stay at home, rest, drink plenty of fluids, take nutritious diet, and do not go out to work. Ideally, the patient should be staying in a separate room, in a well-ventilated room, and if not possible, then she should be wearing mask all the time and keep a distance of at least 1 meter between the caregiver and the patient. And the room should be well ventilated, and if possible, use a dedicated bathroom for the patient. When coughing or sneezing, again, the same precautions. Do not cough and open. Use an elbow or a flexed elbow or a tissue to cough on, and after that the tissue should be discarded in the dustbin. For caregivers, this is very important. The persons who are taking care of the sick at home, what precautions they should be taking. You have to ensure that the sick person, the caregiver should ensure the sick person rest, drink plenty of fluids, and eat nutritious diet. The caregiver should be wearing mask all the time when the caregiver is in the room with the sick person. Do not touch the mask or the face during use, and discard the mask after you are away from the caregiver. Frequently clean your hands with soap and water or alcohol-based hand rub, and separate dishes ideally should be used for the sick person, and wash these dishes, cups, and eating utensils used by the ill person with soap and water. Now, this is a very, very important aspect which I'm going to talk about: vaccination. This is a very important, the worldwide, what we are seeing, that we have been trying to develop something which can cure, which can rather prevent the transmission of COVID and control the COVID pandemic. So the answer is vaccination. So I would tell you about the types of vaccines which are available, and how they are given, what are the myths associated with vaccination, and how they are administered. So the currently available vaccines are, in India, we have 3 vaccines which are currently available: Covaxin, Covishield, and Sputnik 5. So initially we had only Covaxin and Covishield, and by now we have come a long way in vaccinating our population, and India is one of the countries which have a very wide coverage of vaccination. So Covishield was the initial to start with. It is given in two doses. 2 doses are given at 28 to 84 days interval. It is given by an intramuscular injection, and the recommended population for Covishield is 18 plus years. Anyone above 18 years is eligible for Covishield vaccination. The other vaccine is Covaxin, which is also indigenous vaccine produced by India, and it is delivered again in 2 doses and at an interval of 28 days by an intramuscular injection. For pregnant and lactating mothers, from 2nd July 2021 onwards, the Federation of Obs and Gynae India has recommended that all pregnant and lactating mothers should be vaccinated irrespective of their period of gestation. Pregnant women किसी भी time period, मतलब pregnancy में किसी भी महीने में वैक्सीनेशन के लिए एलिजिबल है. ऐसा नहीं है कि इनिशियल 3 months में वो वैक्सीन नहीं लगवा सकती, या अगर वो दूध पिला रही हैं तो वो वैक्सीन नहीं लगवा सकती. All pregnant and lactating mothers are eligible for vaccination, and they should get vaccinated, because They are also immunocompromised, and they are more susceptible for infection. In special scenarios, what we are seeing that if a person turns out to be COVID positive, in those cases, vaccination is to be deferred for 3 months after recovery. अगर किसी को कोविड हुआ है तो उसे एटलीस्ट 3 months वेट करके फिर अपनी वैक्सीन की डोज लेनी है. अगर किसी पर्सन को किसी कारण से हॉस्पिटल में एडमिट होना पड़ा है या आईसीयू में एडमिशन की रिक्वायरमेंट पड़ी है, तो उस केस में भी वैक्सीनेशन को हमें 4 से 8 हफ्ते, 1 से 2 महीने हमें डेफर करना पड़ेगा उसकी डोज को. अगर किसी को फर्स्ट डोज ऑफ वैक्सीन लगी है और उसको सेकेंड डोज से पहले कोविड इन्फेक्शन हो गया है, तो ऐसे केस में सेकेंड डोज शुड बी डेफर्ड फॉर 3 months. So if a patient turns out to be COVID positive, or if a patient gets a COVID infection, in that cases, the dose of the vaccine has to be deferred for 3 months. The patient will take the second dose of vaccine after 3 months of recovery. And if the patient has required a hospital admission or ICU admission, then in that case, in those cases, the vaccination has to be deferred for 4 to 8 weeks. Now, since this January 2022, the government of India has also approved vaccination for 15 to 18 years of children. The adolescents have also come under this category of vaccination, and everybody above 15 years is eligible for vaccination now. 15 to 18 years age group, only Covaxin is approved. Again, 2 doses at an interval of 28 days. And now the booster doses have also started up in India. The booster doses are approved only after 39 weeks from the second dose. That is after 9 months from the second dose. The patient, the persons who have received the second dose and the second dose before 9 months from now can take their booster doses. And it's the same dose, like the person who has taken Covishield will get a booster dose of Covishield, who has taken Covaxin will get a booster dose of Covaxin. And this is very one important thing. This COVID vaccine, don't be under the impression that is going to protect you, like prevent infection. It is not going to prevent infection. You may again get a corona infection after you get vaccinated. It is going to decrease the severity of infection. It may reduce your hospital admissions. It will reduce your severity of the infection. Maybe you just get away with mild symptoms, which we are seeing in this third wave of Omicron virus wave, that the patients are usually coming out with milder symptoms. The hospital admissions and the requirement of oxygen is not much in this wave of COVID virus. So again, even after getting vaccine, you have to follow all the universal precautions. You have to clean your hands frequently. You have to maintain a social distancing. You have to wear a mask. You have to cuff your knees into a bent elbow. You have to avoid touching your eyes, nose, and mouth, avoid going to crowded places, and be in a well-ventilated room. So all these precautions still hold true in COVID vaccinated patients. I would like to clear some confusions and let you know some of the facts which are related to vaccination, which are usually pondering around and which the patients are usually asking, कि डॉक्टर वैक्सीन से ये हो रहा है, हमें वैक्सीन लेनी चाहिए या नहीं लेनी चाहिए, इससे ये दिक्कत हो जाती है, इससे वो दिक्कत हो जाती है. So I'll just take a quick revision of all these myths and the facts. So one very important myth which is going around with COVID vaccine is that COVID vaccine can affect women's fertility. A woman may become infertile or may not be able to bear pregnancy or children if she takes a COVID vaccine. So the truth is that COVID vaccine will not affect her fertility. Absolutely not. This is an absolute myth. Another, that if I already had a COVID-19, I need not take a vaccine. मुझे तो already COVID infection हो चुका है, तो मेरे को मुझे वैक्सीन की क्या जरूरत है, मेरे अंदर तो already immunity आ चुकी है. But this is again a myth. The truth is that even if you had a COVID-19, you definitely need to get yourself vaccinated, because reinfection with COVID-19 is possible, and it is advised to get a COVID-19 vaccine even you have been sick with COVID-19 before. Another one is that ये वैक्सीन तो बहुत जल्दबाजी में गवर्नमेंट ने लॉन्च कर दिया है, इस पे तो एडिक्वेट ट्रायल्स नहीं है, बस कि जल्दी से हमें कोई एक वैक्सीन चाहिए थी तो गवर्नमेंट ने बिना ट्रायल्स के ये वैक्सीन लॉन्च कर दी है. इसकी सेफ्टी और इफेक्टिवनेस के डेटा के बारे में हमें आइडिया नहीं है, तो we should not be taking this vaccine. This is a myth. The truth is that no serious or life-threatening side effects have been reported with this vaccine, and the scientists have taken adequate precautions, and adequate trials have been conducted, and no tests have been skipped before launching this vaccine in public. Another thing is that there's a myth that after I get a COVID vaccine, I should stop wearing my mask and stop taking any coronavirus precautions. No, it is wrong. You should be following all the safety guidelines even after taking the COVID-19 vaccine, because you may get reinfected with a different strain of virus. It only decreases the severity of infection and may reduce your hospital admissions. Getting COVID-19 vaccine gives you COVID-19. This is a very, very popular myth among people that मुझे COVID-19 की वैक्सीन लगी थी, इसीलिए मुझे कोविड इन्फेक्शन हो गया. मैं सेंटर पे गई थी, वहां पे मुझे COVID-19 की वैक्सीन लगी और मुझे कोविड इन्फेक्शन हो गया तुरंत आफ्टर गेटिंग द कोविड वैक्सीन. So this is not true. The vaccine for COVID-19 cannot give you infection. Right, it is only helping your immune system to recognize and fight the virus. It will cause a very mild symptoms of fever, maybe for a day or two. Maximum patients में fever की भी problem नहीं आती है. कुछ patients में they may experience fever for a day or two, a low grade fever or a high grade fever for a 1 or 2 days, but after that they will get normal. But ऐसा नहीं है कि COVID vaccine से COVID infection हो रहा है. इस कोविड वैक्सीन के कोई लॉन्ग टर्म साइड इफेक्ट्स नहीं है, जैसा कि लोगों को लगता है कि शायद इस वैक्सीन की वजह से हमें लॉन्ग टर्म में जाकर जोड़ों में दर्द रह जाएगा, हमें बुखार रह जाएगा, हमारी फर्टिलिटी में कुछ प्रॉब्लम आ जाएगी, हमारे मेंस्ट्रुअल साइकिल्स में, हमारे पीरियड्स में कुछ प्रॉब्लम आ जाएगी, तो यंग गर्ल्स शुड नॉट बी टेकिंग दिस वैक्सीन. बट ऐसा कुछ भी नहीं है. इसका कोई भी अभी तक जब से वैक्सीनेशन स्टार्ट हुई है, कोई स्टडीज हमें ये डिनोट नहीं करती है कि इससे इनफर्टिलिटी हो रही है, या प्रेग्नेंट वुमेन में बच्चों में इन्फेक्शन आ रहा है, या बच्चों में कोई दिक्कत आ रही है, या इसका ट्रांसमिशन हो रहा है मदर टू बेबी कोविड-19 वैक्सीन का. ऐसा कुछ भी नहीं है. द ट्रुथ इज दैट इट डज नॉट लीड टू एनी लॉन्ग टर्म साइड इफेक्ट्स. सम माइनर साइड इफेक्ट्स लाइक एलर्जिक रिएक्शन may occur within minutes on the injection site, which may happen with other vaccines also. जो आपकी normal vaccines लगती हैं, उससे भी आपको हल्का फुल्का वहां पर रैश, लालीपन, या फिर हल्का फुल्का बुखार, थोड़ा बॉडी एक, ये हो सकता है. The same applies to coronavirus vaccine also. The same symptoms you may experience after getting the vaccine. So it is not that you should not be taking vaccine because of all these things. Now, this is one very, very important thing. What is our world is going through, the patients who have recovered from COVID-19, or the patients who are, the families who have COVID-19 patients, they are going through some kind of stress. So we should be talking about the mental health aspect also. So there is a lot of stigma which is associated with COVID-19. Because COVID-19 is a new disease, जिसके बारे में ज़्यादा चीज़ों के बारे में हमें पता नहीं है, और कुछ अभी भी इसके बारे में रिसर्च चल रही है, जिसकी वजह से लोगों के अंदर एक डर है, भय है कि पता नहीं क्या हो जाएगा, आगे हमारे साथ कैसा होगा, हमारी बॉडी कैसे रिएक्ट करेगी, हमारी बॉडी ठीक रहेगी कि नहीं रहेगी. एंड अनदर फेक न्यूज़ रूमर्स which are giving wrong information on WhatsApp, on media, they are also spreading a lot of fear among patients. So there is a fear of falling ill, कि पता नहीं हम जिएंगे या नहीं जिएंगे, हम इतना sick हो जाएंगे कि हम कुछ काम नहीं कर पाएंगे. People have lost their jobs. There is a lot of unemployment. The children are sitting at home. Their fear of losing livelihoods, not being able to work during isolation, being dismissed from work, then not being socially excluded, placed in quarantine because of being associated with disease, being of not meeting loved ones, and fear of losing loved ones, feeling of boredom, loneliness, and depression. All these things have cropped up a lot after the COVID pandemic, and people are experiencing a lot of mental illness and depression and stress because of the COVID-19. But we have to cope up with all these, and you should, in order to stay healthy and avoid sadness, boredom, and being away from scaredness, You should be talking to people whom you trust. You should maintain a healthy lifestyle. Don't use a lot of smoking or alcohol. If you feel overwhelmed, talk to your healthcare provider, call to your doctor, talk to the person whom you trust to get the right information rather than trusting on the fake news and rumors which are circulating all around the media and the WhatsApp. You should find some credible source whom you can trust. Lessen the time spent watching or listening to media coverage. You should spend your time doing the skills or some your hobbies which you have been longing for doing for long, and which that can help you to challenge this time of outbreak. So to summarize, what you can to summarize, what can you do to stay healthy? We have come a long way in this COVID pandemic, and the basic precautions to stay healthy, what we have learned throughout is, number one is wearing a mask. A mask, not only a mask, a well-fitted, a properly fitted mask, which should be covering your nose and your chin. And you should not be touching the outer surface of the mask. Wear a mask properly all the time when you are talking to somebody, when you are in a public gathering, when you are outside of your house, you should be wearing a mask. And while disposing the mask, you should ensure that you remove the mask by your strings and should not be touching the outer surface of the mask. And immediately after removing the mask, clean your hands with soap and water, and or sanitize your hands with a alcohol hand rub. And the third one is social distancing. Always maintain a social distancing, maintain a distance of at least 1 meter from the other person. And another thing which promises to end this pandemic is the COVID-19 vaccine. So in the end, I would just like to say, we all, as we say, that go Corona, go. We want, all of us in the world wants this pandemic to be end, and we just want this Corona just goes away and we all get back to our normal lives and resume our schools, our work, our all normal routine activities. So with this notion, I would like to end my talk, and thanks a lot to all of you. Thank you for patient listening, and thank you.
Now, that was truly informative. Not only has it clarified many things, but has also put us all to delve deeper into this context. Now we welcome questions from you all, if any. Please unmute yourselves to ask the questions.
Doctor, can I ask one question?
Yes, sure.
This is Neha Grover.
Yes.
Like a few days back, it's there in the news that in Maharashtra, according to new COVID guidelines, they have asked children below 5 years of age, like it's not compulsory, it's not mandatory for them to wear mask anymore. So like, what is your take on that? Is it like, it's fine? Is it fine, or is it safe for the children who are below 5, and even for the age group of 6 to 12 years, they are allowed to wear mask under the supervision of adults?
Actually, what the mask guidelines say, that the children under the age of 2 years, the CDC guidelines, the Center for Disease Control guidelines, which are framing all the guidelines regarding the COVID and all the disease worldwide. What they say regarding the mask wearing policy is that it is not recommended for children under 2 years of age, because they are not able to properly wear masks, not able to handle masks. They don't know how to care for the mask. And if they sleep unattended, they may cause they're not able to breathe properly. So in children less than 2 years, the mask is not recommended. And
but that may be, that may be the case under the age group of 2 years, like the way you were saying.
Yes.
But it was mentioned even under the age group of 12 years.
Under the age group, no, under the age group of 12 years, it is not yet recommended. We are not advocating this, that the children under the age of 12 years should not be wearing masks, because they are at a very high risk of catching infections. And nowadays, what we are getting in our clinics is a lot of patients and young population, a lot of children, even the newborn children we are seeing patients, we're seeing the kids who are getting infected with COVID virus. So under the age of 12 years, we will not recommend that they should not be wearing masks. They should be wearing masks.
Thank you for addressing them. Thank you.
Yes, hello, doctor. I'm Bharti this side. I just want to know that if a person has been through with this COVID-19, is he or she well, I mean, he can donate blood after how much time? I mean, if someone has been infected through this COVID-19, so he or she can donate blood after how much time? Is it possible for him or her to donate blood after 1 month?
No, it is not possible.
After how long? That's what I'm asking.
Maybe after 3 or 4 months after the infection is gone. The blood bank policies, the blood bank people, they have their own policies which they frame. They have to check for the virus, like for the chronic illness, like all the viral markers, hepatitis B or hepatitis C, HIV. They are routinely screening the patients for all these viruses, and maybe they can test the person for a COVID-19
That's
virus.
what I said. Before donation also they need to get the test again.
Yes,
Right.
yes, definitely.
Thank you so much. Thank you.
Good morning, doctor. I am Sakshi Gupta this side.
Yes.
Ma'am, the sanitizers are alcohol based and the smell of the alcohol really irritates me. Can I use Dettol solutions?
Dettol solutions will not cover your this thing, because the alcohol, 70% alcohol which we are advocating, that kills the virus. So only Dettol solution will not be able to substitute for this instead of sanitizers. So rather than, you should be using soap and water. That should be more beneficial if the sanitizers are irritating your skin or irritating your hand, right? So only Dettol solution will not be able to substitute.
Do we have any more questions coming? Okay, so now we have some questions from the staff members. I'd like to request our respected principal ma'am to propose the vote of thanks.
Thank you. And thank you, Dr. SRISHTI. Indeed, a very enlightening session in these challenging times. We are in the, I think, third year of this COVID-19. We are under the cloud of COVID-19 for now a pretty long time. And your session, I think, it was a very holistic, a robust session, I would say, where you started with what the thing is. And where do we see ourselves? Like how we can, the myths also. My teachers are facing that challenge because 15 to 18 years, that's a must for the vaccination. And there are a number of students who are still not vaccinated. And when we ask the students, some or the other excuse comes from, from the parents' side.
Yes.
So I think the teachers are also now equipped with the answers. They're empowered now. You can actually take away the learnings and you can address the concerns of the parents also. And I think there would be parents on the YouTube live, and there would be students also. So please, students, they have to get vaccinated. All those who fall above the age of 15 now should be vaccinated. And there is no, what Dr. SRISHTI said, like there is no harm in it. We can always, we have to encourage and we have to ensure that everyone is vaccinated. And on the other side, it really feels very, very good calling our alumni doctor. So, a doctor addressing our alumni as a doctor, it gives you a sense of pride, and all the students and all the teachers, those who have taught her, who are here right now, who know her, I know what a moment of pride it would be. Even on behalf of Poonam Gupta ma'am, I would say, like, she would have been actually, delighted.
She was my chemistry teacher at that time, and she has taught me a lot, like addressing my minor to minor queries and like giving me whatever she can. She has in her. So I'm really thankful to her for all her efforts which she had made to bring me at this point.
We are like, thank you
Good
so
morning,
much.
ma'am. Good morning, ma'am. This side Alka Agarwal, ma'am.
Yeah, Alka.
I can't express my thoughts that I taught this girl. This was my
maths teacher.
And I was her maths teacher. I really, and whenever I told her that, SRISHTI, no, you have to take the session. She told me, ma'am, no, I cannot take on Saturday. It's very busy. but I force her to take, and she has replied yes. I'm very much thankful, Srishti.
Thank you, Alka ma'am.
And we are delighted. We are delighted,
Yeah.
Alka ma'am, for your efforts. And Srishti, I know your time is very precious, very hectic, but giving that time out for our parent body, for our students, for our teachers, thank you so very much.
Thanks a lot, ma'am, for bringing me here, like coming to school, talking to you all after a long period. I passed out in 1998. So it's been a long journey since then. And coming back in front of you all, it gives me immense pleasure. So Alka ma'am contacted me. I was really delighted to be here. So thanks a lot for bringing me here, ma'am.
And thank you once again for a wonderful session.
Thanks a lot. Okay.
Thank you very much for listening and being a part of this immersive session. I, once again, on the behalf of our school, would like to thank Dr. SRISHTI Agarwal for her precious time. Thank you very much.
Thanks.
Thank you. I think we'll make a leave now.
Purnima, please end the meeting.
Have a great day, everyone.
Thank you, ma'am.
Thanks to all.
Thank you, ma'am. Thank you, ma'am.
Thank you, ma'am.
Thank you.